Hi, my name is Sarah Davies, and today I'll be presenting the effect and influence of telehealth perspectives. In this presentation, I'll explain how different groups, including providers, patients, policymakers, and technologists, each play an important role in shaping telehealth. I'll also discuss how their collaboration impacts healthcare access, quality, and the future of virtual care. Integration of perspectives. I'll be explaining 4 of the perspectives of telehealth, including providers, patients, policymakers, and technologists. All 4 perspectives intersect to shape telehealth and improve the model to shape virtual care for the future. They all contribute to healthcare access, equity, sustainability, and innovation of telehealth. Telehealth is not built by one group alone. It is shaped by these perspectives. These groups intersect to improve how healthcare is delivered virtually. Provider perspective. From the provider's perspective, telehealth depends heavily on support from patients, policymakers, and technologists. Providers rely on technologists to create systems that are safe and easy to use for things like documentation, follow-ups, and remote assessments. They depend on policymakers for clear rules about reimbursement, licensing, and privacy protection. They also rely on patients to communicate openly so providers can understand their experience and improve care. For example, with patients, by patients explaining how certain appointments went, how it made them feel, if they were comfortable, if they felt safe, if they felt like it did anything, it helps shape the delivery of telehealth and impact how the provider sees this delivery. As policy expands and technology improves, providers can deliver more remote services, perform better virtual assessments, and build stronger trust with patients. For example, right now there are certain policies about which providers can practice in different states. There's a lot of licensure about that, but shaping these policies could contribute to more patients getting seen and patients seeing certain specialties. Patient perspective. From the patient perspective, telehealth is shaped by technology design, provider workflows, and health policies. Patients collaborate by testing platforms, sharing feedback, and participating in shared decision-making with providers. They also advocate for safer and more accessible systems. Right now, with the integration of AI with many different businesses and even healthcare, patients often worry about if there's fraud or if their privacy is getting out. And so just being really strict with policies and explaining those policies with patients could create better trust between patients and providers, as well as patients and telehealth as a whole. And then telehealth also allows patients, especially in rural or undeserved areas, to access care more easily. It also increases trust, improves participation, and gives patients a more comfortable way to seek care without fear of judgment. In my opinion, I see telehealth as kind of a wall or a screen where there is a kind of gap between patient and provider, which could help them feel less judged or more open to talk about things that they wouldn't necessarily talk about in person. And I feel like it gives a good option to people who are uncomfortable with face-to-face or have a hard time talking to people about things that they don't necessarily want a lot of people to hear. Policymaker perspective. Policymakers play a powerful role because they determine what is allowed, how much services cost, and how patient privacy is protected. Their decisions affect every part of telehealth, including who can access services and which specialties can offer virtual care. Like I said before about the location, like states and providers being allowed to practice in certain states, that comes to policies as a whole. And determining what providers can and can't do and thinking about how each perspective may be affected by these policies is really at the heart of a policymaker, as they can impact everyone's perspective in such a great way. And then collaboration, patient needs and ethical concerns, they are basically in charge of that, and they're in charge of making patients feel comfortable based on the policies that they make. Technology security, going back to privacy and fraud and how that may impact telehealth. And then provider safety and reports. This can impact the workflow, how patients may feel safe as well if they know that there's various reports going on how the workflow is going, how providers are treating patients, stuff like that. And then impact of change. Policies can affect accessibility to various patients and specialties. Patients can lose access or wait longer for appointments, and technology companies could lose business. So based on various policies that these policymakers can input into the system, affects telehealth either in a positive or negative way. This is showing how it affects in a negative way, that like if policies are stricter, patients can lose access to various specialties or certain doctors that they want to see, and it can make wait time longer for going to in-person appointments. Technology companies could lose business if less patients are using telehealth in the online route. And then policies, as I said, can affect this and many other stuff. Technologist perspective. Technologists focus on building tools that keep telehealth running smoothly. Their goal is to create platforms that adapt to healthcare challenges while supporting providers, patients, and policy requirements. In my opinion, I feel like technologists, their goal is how they can make everything run better and how they can improve everyone's life based on technology. And they're basically the solution makers of telehealth and healthcare, in my opinion. For collaboration, they work with providers to design practical features, patients to test usability, policymakers for security. The heart of the solution is to help patients the most. And then by helping patients, it also helps providers, policymakers, everything. By making patients happy, making patients safe and comfortable, it increases the other perspectives in their jobs. It makes it so much easier. Impact of change. Providers can have the ability to track chronic conditions remotely. Patients can get their needs met sooner in a more convenient way, and policymakers now have a way to expand care. I think the one that is especially powerful is the tracking chronic conditions remotely. For example, type 1 diabetes has had a lot of improvements in the past couple of years with like their tracking devices, their pumps, and there's so much research and solutions currently being made to help that. And I think that makes it so much easier to provide telehealth as a method of care, as they can just look at all the data remotely and then talk to the patients rather than poking their finger for a blood sugar or something like that, or having to come in sooner, or examples like that. And then policymakers now have a way to expand care by creating various solutions. Policymakers have an easier way to form their policies and see how various policies can impact it by statistics and AI predictions and stuff like that. And then finally, patients can get their needs met sooner in a more convenient way. Like I said, with using the type 1 diabetes example, if the patient was feeling off or like they're concerned with their numbers, their blood sugar numbers or anything, they could easily contact their doctor and find ways to improve the solution rather than having to go into the office and run tests or do things in person. Finally, cross-sector collaboration in the future of telehealth. All four perspectives must work together to create equitable, effective telehealth care. If one group fails to adapt or contribute, it can create a ripple effect that impacts care, quality, and access for everyone. I think the key word here is adaptation. Telehealth is a relatively new form of healthcare. It still has so many ways that it can improve and ways that it can be more accessible to various people. And so all the perspectives, recognizing that and recognizing that with trying new solutions, there is going to be things that do work and things that don't work. So just working together to adapt and try to problem solve together to create better care. And then for the future of telehealth will greatly impact the future of healthcare due to its widespread starting from COVID-19 pandemic to now. I predict that it will be a hybrid care, will be the new standard for healthcare, growth in remote monitoring with integration of new AI devices. Policies will shape as new technology comes out, as well as more patient participation. Telehealth will continue to shape toward a patient-centered approach as technology, policies, and provider attitudes continue to improve. The patient-centered approach is really what is important to focus on with telehealth, as I feel like with all the craziness around it that telehealth is this great new thing, I feel like it is important to not lose sight that the reason we are using telehealth is to benefit the patient before any other perspective. And then by using hybrid care, I think using both in-person visits and telehealth visits will help the patients get less shorter waiting times, be able to be seen faster, and obviously there are things that can't be diagnosed online, so just mainly focusing on telehealth, but then also including in-person visits as well. And then I already talked about how AI devices through technologists that using AI to predict statistics, planning, how certain devices might impact and stuff like that. But I think really the main part of telehealth is that as technology and everything evolves and telehealth is getting started to use more, just recognizing that it is an all perspective approach and that the goal is to impact the patient first. Thank you for listening.